One moment to update. Technology. It's going to redirect me. Okay, we are live. Good morning, everyone, good afternoon, and welcome to our virtual chronic pain symposium. My name is Kelly Rosetta, and I am the creator and executive director of the Portland-based nonprofit More Than Lupus. Today's extraordinary event featuring chronic pain specialist, Dr. Stephen Grinstead, will be a special one. As we delve into this subject, we encourage you to be open and vulnerable and patient with yourself. Take notes.
Yes.
Comes up that you want to ask, take notes. Be in the moment. We have no doubt that many of the things that you'll hear today will change your perspective on one of the most difficult lupus symptoms, chronic pain. So without further delay, it's my pleasure to introduce today's speaker, Dr. Grinstead. Dr. Grinstead was the co-founder and chief clinical officer of a residential and intensive outpatient chronic pain management program in California. He is the author of the book, Thank You Adversity for Yet Another Test, a body, mind, spirit approach to relieving chronic pain suffering, as well as author of several other pain management books, including Freedom from Suffering, A Journey of Hope, Managing Pain and Coexisting Disorders, and the Addiction-Free Pain Management Recovery Guide. Dr. Grinstead is also an internationally recognized expert in preventing relapse related to addiction and chronic pain disorders, and is the developer of the Addiction-Free Pain Management System. Dr. Grinstead has a bachelor's degree in behavioral science, a master's degree in counseling psychology, and a doctorate in addictive disorders. He is a licensed marriage and family therapist and a past California certified alcohol and drug counselor and an advanced relapse prevention specialist. He has been working with chronic pain management, substance abuse disorders, eating, addiction, and coexisting mental and personality disorders since 1984. Dr. Grinstead has almost 40 years in recovery from alcohol and pain pills and has been living with his own chronic pain since 1982. He offers many free resources on his website, which is drstevegrinstead.com. So be sure to check out his article page and his video blog page. He has also offered a PDF of today's slide presentation today for your convenience as well. Thank you so much, Dr. Grinstead.
Hey, everybody. Thank you for having me back. This is my second time with this symposium, and I'm very excited. I was very honored that, Kelly, that you invited me back. Thank you so much. And I really hope that we can have some fun today. So I'm going to go ahead and move into our regularly scheduled program, and we'll just see if we can have some fun. So moving out of the problem into the solution is my whole focus. If we stay stuck in the past, stay stuck in the suffering, stay stuck down in the muck and mire, that doesn't do ourselves or anybody that loves us any good. So, you know, Kelly's already introduced a lot about me, so I'm not going to go into that anymore, except to remind you, please, lots of free resources on my website. So I have some questions for you, and I want to see some buy-in. I want to hear you. You know, you type in your buy-in. Are you ready to be willing and open? I hope so. Are you ready to learn some valuable tools? And most importantly, are you ready to have some fun today? I want everybody to be able to say yes to these three questions, because this is so important that we're on the same page here. I love teaching. My mission since 1991 is to teach people how to help people, because if you help yourselves, you're going to help your families. So please have fun today and learn. So I'm going to, tell you what we're going to be doing just briefly. I'm going to talk about a phenomenon I labeled the chronic pain trance. And part of that trance includes our inner saboteur, our relationship with our pain, and the difference between pain and suffering. So it really is time to wake up. You know, it's really, being in that trance is no fun place to be. I was there. Like Kelly said, I've been living with chronic pain since 1982. At that point in my life, the world was my oyster, so to speak. Everything was happening. I was getting ready to transition out of being an electrical contractor into the world of teaching martial arts and opening my own dojo. And then all that came apart in just a few hours when I really injured myself so bad I was paralyzed from the waist down and told I would never walk again. And that was a very demoralizing moment for me. And it scared the hell out of me. It made me hopeless, helpless, and I sunk into that deep, dark pit I call the chronic pain trance. But fortunately, because of some of my recovery friends and because of some really awesome mental health specialists, I was able to wake up and move out of that problem into the new solution. And a couple of years later, I started working, helping other people with chronic pain and coexisting problems. So that adversity turned into opportunity for me, and I'm so excited about that. So a lot of today's presentation is based on what I've learned since I've got my own injury, plus all the research I've done, all the work I've done in the field, all the books I've written, all the peer-reviewed articles I've published, and plus training over 40,000 healthcare providers how to do what I do. And on top of that, I've had an opportunity to work with literally thousands of chronic pain patients, and that is my passion. So when I say it's time to wake up, that's because I know it's possible and it's preferable. So I want to talk first a little bit about the chronic pain trance, then look at the role depression plays, especially untreated depression. And most importantly, the inner saboteur, also known as denial, that psychological defense mechanism called denial, that ends up wanting to help us, but it ends up hurting us. And then we'll talk about, here's a tough term, cognitive behavioral restructuring to wake up. So I'm going to make that really clear. You don't have to get too worried about what that means right now, because I'm going to break it down and keep it simple and short, because it is possible to do this. So a lot of people, when I work with them, I'll ask them, for you, what is your chronic pain trance? I want to learn about it. I want to learn where they're at, because, you know, the worst thing I think you can do for somebody is tell them, oh, I know how you feel. That is not helpful. You know, no, nobody knows how I feel. But what I want to do is I want to learn how you feel. And I want to explain and normalize and depathologize this and let you know it becomes an automatic and unconscious coping style, that you're doing it because you think it's the only way you have. And you end up staying there long enough, you end up getting hopeless and helpless and see no way out. For me, you know, I contemplated suicide as an option. Fortunately, I had some good people in my life and I got out of that mindset really quick. Now, I also am somebody that likes to go for the fix. I want to fix this. And so I used all my martial arts training, all my Marine Corps training, and I kept setting myself back. Fortunately for me, my physical therapist was also a Marine, and he says, look, this isn't preparing for the obstacle course. This is getting you ready to run the obstacle course. Slow down. And that's what I did. So coming out of that trance was really helpful. I had to give up the magical thinking, the quick fix mentality, and resign myself that this is going to take time and hard work, but it will be worth it. And so breaking that trance is really important. I was going to a lot of Dr. Stephen Covey's workshops back in the 90s. He wrote the book, 7 Steps for Highly Effective People. And one of his things he said that day just really blew me away. I'd heard many things similar to this over the years, but when he said it, the student was ready. He said, you can't think your way out of a problem you behaved your way into. Or in my case, I injured my way into. you need to get into authentic action. So I'm going to be inviting you throughout this presentation to stop and develop some calls to action for yourself. And at the end, we'll summarize. Now, the big part about solving a problem is identifying and recognizing exactly what the problem consists of, which is really important. And then having hope. You know, if nothing else happens today, but you come away from this with a little more hope that your life can be better, I've done my job. And I promise you things can get better. So one of the things that will stop us, though, is if we run into the depression barrier. And I've had this come on and off over the years several times. And there is a difference between depression and just feeling down or blue, feeling kind of low energy. But when we have depression, especially for those of us suffering or living with chronic pain, it's one of the most common co-occurring problems people experience. And one of the things that happens with depression is isolation. I call it the deadly duo. Now, people with chronic pain tend to isolate a lot also. And then when you get depressed, you want to isolate more. And then with this whole COVID thing, we've been giving permission to isolate. Matter of fact, we've been mandated to isolate. And it's the worst thing we can do. I'm very grateful for video conferencing like Zoom and other platforms because it's allowed us to reach out and get face-to-face with people. So one of the first things I do with my patients is I want to go through some of the 9 common symptoms of depression and see how many they have and how strong they are. And just explain to people that this is normal. This comes apart from your depleting some of your neurotransmitters in your brain, and some people need to have some help with that. But before I move into suggesting seeing someone for medication management, there's some other things we can do besides medication for depression. And we need to develop a personalized depression management plan because one size doesn't fit all. And I've helped, like I say, thousands of people develop thousands of different types of depression management plans because we're all unique individuals and we all need our own focus. So when we do the plan, sometimes medication management is important. And that cognitive behavioral therapy has proven to be one of the most effective interventions for depression. So for mild to moderate depression, that's usually all that's necessary. When people have moderate to severe depression, though, we usually need to pull in somebody for some appropriate medication management interventions. And in addition to developing a proactive action step plan. So don't just depend on taking a pill and you're going to be fixed. That's where people fall down and go boom, because we need to have at least 4 or 5 things we're doing besides the medication, because my goal of working with people with depression is to work them off of the medication so they can be less dependent upon a foreign substance to improve their quality of life. And they can learn that they're in charge of that for themselves. So thinking about what we've just covered, we've just covered a few baby steps right now. We've talked about this trance, we've talked about the role of depression, and I want each of you, Kelly asked you to have something to write with. I want you to write down what's the most important thing you learned in this segment. And in a minute, you're going to be typing in comments or questions, and I want to have this be a little bit interactive. And that once you identify what you've learned, what is 1 or 2 things that you can commit that you're going to do different to improve your quality of life from what you learned so far. And I know we've only been going a few minutes, but this is a call to action. Now, once you identify your goals, the 2 things you're going to work on, what might get in your way? How might the inner saboteur try to talk you out of doing this? And what are you going to do to overcome this? Well, one of my suggestions is it's time to be thinking right now and write these names down. Who are 3 appropriate accountability partners? Now, appropriate accountability partner is someone you trust, who won't be judgmental, shaming, and blaming, but also won't be enabling or codependent with you. These are people that want to see you succeed and achieving your goals. So right now, I want you to write down 3 people that you can be sharing what you're doing on this seminar today with. I want you to have their names down, and I want you to be willing to share what you're going to be attempting, and then have them help you be successful. So at this point, does anyone have any questions before we move on, or any comments? I'd like to hear a couple people, what people are getting and what you're going to do different too. It's your turn.
Yes, we do have a few that have come in through our Facebook feed here. One is from Estella, who is in Southern California. And she said people do tend to isolate and feel depressed when dealing with daily chronic pain.
Yes, absolutely.
One of the things that Janet has learned from this session is, yes, reducing meds can equal reducing side effects. We don't think about the side effects that some of the medications can have.
Yeah, and with those side effects, what tends to happen then is instead of dealing with the side effects non-medication, they put us on another medication to deal with the side effects. And man, we just don't need that.
And then Deneen wrote, I learned that you deplete neurons from chronic pain. That was a new concept to her.
Yeah, serotonin, norepinephrine, dopamine, all those get depleted. And those are all neurotransmitters that keep us functioning at a higher level.
Let's see, I think that was all that I got from your first question.
Okay. What are people going to do different?
Deneen followed up and said, COVID has given us permission to isolate. Quite challenging.
Yes. So are you going to stop isolating no matter if you have permission? That's my next question. Okay, so if nobody else has any comments or questions, I'll move on. We'll go to the next piece. On this piece, I want to talk about what is the inner saboteur. So stop a minute and ask yourself in your head, when you see that term inner saboteur, what pops in your head? And feel free to type something in. And Kelly, if somebody types something in, let me know. But what do you think about when you think inner saboteur? What does that mean to you? And I'll give you some examples of mine in a little bit. So for me, part of this is this internal dissonance or internal conflict. This, to me, epitomizes internal conflict. This is what's going on in my head. And I'm happy, I'm angry, and I'm sad all at the same time. And I have all these voices in my head, and then it's like, which one do I listen to? And this is how I end up. I end up crazy. It's like I'm being deluged, and they're all trying to help me. That's what you need to realize here. These are not malicious parts of us. These are well-meaning parts of us that are trying to support and help us, but they're coming from so many different directions, and they're so confusing. So one of the things I learned from my dad, he was into Native American lore, and the story I love the most that I actually read at his eulogy was the story of the 2 wolves that the wise grandfather was telling his 2 grandson braves before they went out on their first mission. And he was telling them about inside of us all lives the battle of the 2 wolves, the good wolf and the evil wolf, and how the evil one has a lot of things, and you can see them. By the way, these handouts are available to you, of envy, sorrow, greed, arrogance, resentments, false pride, ego. And the good wolf has things like joy, peace, love, serenity, generosity, truth, compassion. And at the end of his story, the grandson says, well, grandfather, which wolf is going to win for me? And the grandfather says, that is very easy. It's the one you feed the most. So if we focus on all these positive qualities, these spiritual principles, then that wolf is going to be in charge of our destiny. If we listen to the other one, we're going to be causing ourselves more suffering. And that's what today is all about, is freedom from suffering. So we need to find freedom from suffering from that evil wolf. Years ago, as I was training in the martial arts with Sensei Kim, we were getting ready for this big tournament, and we were literally bouncing off the walls, warming up, anxious, excited, adrenaline rushing. And Sensei walks in and says, the jungle is restless. Let me tell you about the monkey mind. It's a Zen concept that goes back thousands of years. And it's that part of us that's always hypervigilant. It's swinging from worry to doubt to fear. And it's always looking for, keyword, perceived danger. So it may not be really danger, but it perceives it as danger. And when monkey mind is active, it has the emotional, intellectual reasoning of a 3 to 4-year-old. So when the monkey is in charge, our life is being controlled by that 3 to 4-year-old. Any of you have parented 3 to 4-year-olds? It can be pretty, is that what you want in charge of your life? So remember the monkey mind. That's part of the inner saboteur. And then for me, to help drive this home, this isn't something that develops overnight. It starts from childhood. And so for me, I got into the story of how did I develop all my inner saboteur? So I says, well, my metaphor is I developed a protective but grueling suits of armor. Now, a little bit about me. I'm the oldest of 9 boys. I was born in 1950 in Southern Colorado. And my mom finally, when I was 3 years old, I had, it was me, a little brother, and one on the way. She wanted to settle down and have a home. And then by the time I was 5, here I am, as you might imagine, with mom pregnant and having newborns all the time, I didn't get much attention. So I had 3 brothers at this time, one really, really new. And what happened in June was, it was my birthday. June's my birthday month. And here I am going to turn 5 years old. And my daddy, he invited me to come with him on this big fishing trip. It's a week-long fishing trip he went on every year with a couple of his work buddies. And it was up in Pauline Creek. It's up near Gunnison, Colorado, up in the middle of nowhere. It takes 4-wheel drive vehicles to get there. And so what happened was I got to go. Excuse me for just a minute. My dog just stepped on my foot. I'm sorry. So here I am, 5 years old. I get to go to Colorado. I got to spend this time with my dad and his 2 buddies, getting all kinds of attention. And one of my dad's friends decided he wanted to throw a snowball down my neck. There were still snowbanks up there in the high country. And I was a little maniac. I was laughing and running, and I'm not going to let him catch me. And he wanted to get this snow down my shirt and make me cold. And I was come to the edge of this overhang, and I decided, I'm going to jump. He's not going to get me. And I jumped. And I fell down and sprained my ankle. And here I am, 5 years old. When I went over that cliff, I was all alone. I was crying. I was scared. I was hurting. And all of a sudden I looked up and I saw my daddy running for me, and I got happy and excited. Oh, everything's going to be okay. And then what happened next shaped the next 15, 20 years of my life in not so positive way. And it's not about blaming my dad. It's about how I made some adult decisions with a 5-year-old intellect. So what happened was Dad came up to me all concerned, worried. He checked me out. He felt around and found out he didn't break my ankle. Everything was cool. It wasn't even swelling that bad. And so all of a sudden he jumps me up on my feet. He says, Stevie, quit crying or I'm going to give you something to cry about. Real men don't cry. You've got to be tough in this world. At that point, I made a decision. I want my daddy to be proud of me. I quit crying and I swore I was never going to show weakness again. And I put on my first suit of armor. It was like a leather suit of armor, covered me from head to toe. And a number of adverse childhood events happened, and my armor started getting stronger. And some pretty bad things happened, and I didn't talk about it. I didn't show any pain. I didn't show any tears. I don't ever remember crying. And then at some point, I was injured at about 12 or 13 years old playing sandlot football. And now I found the next suit of armor. It was pain pills. And the pain pills, I got injured. I hurt my lower back, got rushed to the emergency room in Pueblo, Colorado, St. Mary Corwin Hospital. And the Grinstead boys were very well known in that ER because one or the other was always there because we were very hyperactive, acting out kids. And I don't know what they shot me up with. It was probably Demerol looking back, but I do remember what I got sent home with. I got sent home with a prescription of Tylenol codeine. Now remember, I'm the oldest of 9 boys at that time. There were 7 of us at that point, 2 more still to come. And I was the designated parent when Dad was out traveling on the road, and my job to take care of the house. I was super responsible, and I was always anxious and worried because if my brothers got in trouble, not only did they get punished, but I got punished. And yet, when I took that first prescription, it changed my whole world because I felt at peace for the first time in my life. Now it was really armored up. And a little bit later, I started noticing there was a warning label on the pill bottle. It says, do not use alcohol with this medication. And okay, why not? Well, in real small print that most people read would say, okay, now I know that proves I shouldn't take alcohol with this. But with me, when I saw that, it was like, oh yeah. And the fine print said, alcohol may intensify the effect. Game on. So alcohol and pain pills were my best friends for a long time. I was also very angry inside. That was one emotion that was okay to show. Real men were angry and strong and aggressive. And so in high school, I ran with a pretty tough gang, one of the bad gangs. And this was the day before the gangs were using guns or anything, but we were using chains and clubs and brass knuckles, things like that. I was not a very nice teenager. And then I joined a professional gang called the United States Marine Corps, and that's where I put on the heavy duty armor. And today there are times when these suits of armors pop back on despite my best intention and all the healing I've done. So they're pre-programmed in there. They'll never go away. The good news is I've learned how to remove the suits of armor so I can interact, because I mistakenly believed they were keeping me safe, but they were also keeping me apart, especially from intimate relationships and from people that cared about me. So today, because of this journey, I want to support and empower people who are motivated to transcend their challenges with their health, like lupus, with chronic pain, medication problems, addiction, or any other illness, so they can have an extraordinary life, that they can have really powerful, intimate relationships and do what they love with passion and commitment and discipline, and they can focus. That's why I keep doing what I'm doing. This year in June, I turned 70, and I'm ready to slow down a little bit. I don't want to stop. I want to keep sharing the message, and I want to help people learn that there is hope, and you can overcome adversity with hope. And so no matter what you call it, the evil wolf, the committee in the head, the monkey mind, or the suits of armor, what it really is an automatic, unconscious set of mistaken thoughts, beliefs, opinions, and conclusions that we hold to be the truth, the whole truth, and nothing but the truth, despite overwhelming evidence in some cases. So we need to be able to recognize this inner saboteur, and it's part of us, so we can't fight it. We've got to call a ceasefire. We've got to find a way to get out of our self-defeating thinking cycles, because what happens when we develop those problematic perceptions and beliefs, it leads to negative thinking, that internal self-talk that reinforces those beliefs. So we don't allow anything that opposes our beliefs and perceptions in, and we find anything that reinforces them, and we engage in with people, places, and things that are going to also encourage us that our beliefs and perceptions are the truth. And in some cases, including criminal thinking errors. I've worked with a lot of people in prisons, federal and state prisons, and a lot of them are there because of their inner saboteurs. And then we surround ourselves with others who also support these perceptions and beliefs. I believe that people treat us the way we train them to. Now, that's a pretty scary thing, right? But it can be a very empowering thing too. A lot of chronic pain patients don't have very good limits and boundaries. We're not very assertive sometimes. We're actually pretty passive when we get in that depressed, isolative state. So we need to learn to teach people how to teach us better and to support us in positive ways. It's another reason why I want you to be having these 3 accountability partners nailed. And I want you to sit with them, talk with them, and allow them to support you in reaching your cherished goals. And even though sometimes we experience negative consequences, there's been times in my life I wasn't going to let go of my beliefs, my perceptions, no matter what. And that's what happens. And that's what reinforces that inner saboteur. And this can get in the way when we have dreams and goals. You know, anything seems possible. We're living in what's called metaphysical reality, where it's high energy state. We can see it, we can taste it, we can feel it. We know we can do this. But then we hit what a former mentor of mine, Dr. Maria Nemeth, calls trouble at the border between metaphysical and physical reality. That's where the monkey lives. That's where the inner saboteur lives. And this is where we talk ourselves out of some exciting possibilities. And before I ask you what yours are, one of mine, I had a lot of them, but the biggest one that stands out to me was in 1999. I was about 2/3 way through my doctoral dissertation, and it was taking way more time and effort than I thought it would. And it was causing me to not go out on the conference circuit, international conference circuit, as much as I wanted because I had to do too much college work. And so I called my mentor, Terry Gorski. That one's still hard for me. Terry died a couple of months ago, and when I think about him, it still hurts. But he was a true mentor to me. And so I called him and says, Terry, good news. I'm going to be able to do more for you. And he says, why is that? He says, because I'm dropping out of the dissertation and dropping out of the program. He says, the hell you are. You get your butt back in there. You're not doing another thing for me until you do. And that was a tough love intervention. He was one of my accountability partners. And I allowed him to give me those kind of directives. I signed up for it. And I want everybody to think, can you think of a time when you got in your own way, that you really wanted something really bad, and the main reason it didn't happen was you got in your own way? Just write that down. This is something I want you to share with your accountability partners. If anybody wants to share that with us, please free to type it in. That's fine. But this is something I want you to be doing for yourself, and share it with somebody you trust. If you don't want to put it on this big forum, that's fine. Okay. So a lot of times, because we talk ourselves out of these dreams and goals, we get so fixated on our own beliefs, perceptions, opinions, and conclusions that becomes our whole universe. That red star you see in the center of your screen, that's all that exists. You get tunnel vision. You don't see anything else. So what you miss out on is the whole universe of other exciting possibilities that you could be focusing your time and attention on. But instead, you're in that trance, that chronic pain trance. You're in that deep, dark pit. And that's all you see is blackness everywhere. And the monkey is talking to you, and it's keeping you stuck. And I want to invite you to step out and pick one of these goals, one of these things that you would really love to have happen. That's why I'm asking you to be developing these calls to action during this seminar, is so you can start doing things differently, because it takes authentic action to get out of the problem and into your own personal solution. Because I can't tell you what that looks like. I'm a damn good coach and guide, but I don't have anybody's answers. I'm just good at helping people find theirs. And I'm hoping I can coach and guide some of you into finding some new alternative things that you can be doing to improve your quality of life and levels of functioning today. That's my big goal for today. So there's a thing called decision point management. And let me set it up by explaining it this way, where we need to have some breathing space. Because when we have these beliefs and perceptions, those lead to negative thinking and uncomfortable feelings. Those negative thoughts and uncomfortable feelings lead to self-defeating urges and then actions. So what happens for a lot of us is we hit that trigger point and we go from the thought and the feeling right to the behavior, the negative behavior, and wonder, oh, why is everybody mad at me again? Why am I failing again? Because there's a place called the decision point, and we made an automatic and unconscious decision instead of an informed consent, authentic action decision. We need to make better decisions. And there's a 5-step process that I want to teach you now on how to get better at this. And it's going to tie into what we're covering later, the role of stress. So the 5 steps to making better decisions start with putting myself in a timeout and noticing the self-defeating urge or impulse and not do anything about it. Just pause. That's the first step. Timeout. And when I'm in that timeout, I'm not allowed to obsess about why I'm in that timeout. My whole goal is to start finding ways to regulate my emotional dissonance and bring my levels of stress down. A very simple tool is just taking slow, deep breaths and imagine the stress draining from our bodies. And I'm going to introduce you to a stress thermometer in a little while. And when we're above 6 on this stress thermometer, we're not able to make really informed consent decisions. So we got to get down into the 4 or 5 levels of stress. And to do that, we've got to do some things to calm us down. Once we get calm, then we got to go to the reflect step. We need to say, okay, how did I get myself here again? What is it again I want to do that's caused me pain and problems in the past? What's going to happen if I keep doing this? Then the most important part is, what can I do instead? What is the next best steps? So that leads us to step 4, which is the decision-making step. This is where we pull in our accountability partners, including our higher power. We want to pull in spiritual energy here. We want to pull in our 3 accountability partners and help brainstorm with them. This is what I'm thinking, but I might not be the best judge here. Like I wanted to quit that dissertation program. Terry said, that's not a good idea. And if you do, you're not going to go out on the road for me anymore. So you better get back to work. So the decision step is really crucial. We not do that by ourselves. We get some reality checks. Now, a lot of people can do these first 4 steps. And I'm just wondering if anybody besides me has ever tended to procrastinate just a little bit. Because the next step is to execute. Do it. When you make the choice, get into action. And remind yourself, you're going to be responsible for the action and the consequences on self and others. So basically, it's easy does it, but do it. So pause, relax, reflect, decide, and do. Those are the 5 steps. This isn't something I have people memorize. This is how I have something that needs to be internalized. In our program, for the 3 years we operated, and in my private practice, I had a poster on the wall that looked a lot like this. So the first bullet was pause, put yourself in timeout. The second one was relax, practice relaxation response techniques. The third one was what got me here, what can get me out. The fourth one was to make that decision. What's my best choice for moving forward? And then execute, do it, take authentic action. So lowering stress, making good decisions, and then getting into good behavior, make things happen. So this poster really made a big difference for a lot of people. They were able to look up and see that, oh yeah, I'm on autopilot here. I better step back. Pause, relax, reflect, decide, and do it. So the other thing that happens though is a lot of times when we have the inner saboteur or what is called denial, sometimes we see that as a bad thing. But remember, denial has good or bad outcomes. It's not good or bad in and of itself. Sometimes there's a very good reason for these defense mechanisms. There was a lot of times it's a damn good thing. I had my suits of armor. There's a good thing today that I can pull on those armor if I need them to protect myself against painful reality. So I want to talk about normalizing it. Is denial is all it is. It's an automatic and unconscious reaction that's hardwired into us from childhood that defends us against painful reality, the pain of recognizing we're having serious problems. And the other downside of it, though, is it can lead to our problems getting worse because we're not paying attention to them. And it's a normal part of being a human being on classroom earth. That is the piece I want to share with you. This segment of the presentation comes from my Denial Management Counseling for Effective Pain Management book that I co-authored with Dr. Corey and Terry Gorski. And it was a big revelation for a lot of people when we looked at the inner saboteur using these patterns. So let me talk a little bit more about denial because it needs a fuel source. It needs power. Our shields, my armor needed power. It needed to be made of really good material. And so anger is one of the strongest power sources that we have. Now, anger is always a secondary emotion. There's always other feelings that fuel it. And the primary fuel for anger is often fear. But real men aren't afraid, right? I didn't learn that fear was okay until I got in the Marine Corps and we were told that fear is inevitable. Courage is overcoming fear. And you just don't let fear eat you up. You need to overcome it. So fear is okay today. It's not a bad thing. But up until that point in my life, I would not allow myself to feel afraid of anything, which led me to doing some pretty scary things. And the next thing that happens is guilt. We start beating ourselves up because of mistakes we made. We see mistakes as something horrible, awful, terrible, instead of seeing them as learning opportunities. So we feel guilty. And underneath that guilt is the toxic shame. I'm flawed, I'm defective, there's something wrong with me, especially those of us that have had adverse childhood events or some kind of trauma during our adolescent or adult years. Toxic shame is a real common, and it's a very strong power source for our inner saboteur. For the monkey mind, it's the super steroid bananas. So when we have this anger, fear, guilt, and shame, that leads to where thinking about and talking about our problems just hurts way too much. Now, don't get me wrong, these aren't the only 4 drivers of denial. Any uncomfortable emotion can fuel our defense mechanisms, our denial patterns, feed our monkeys, reinforce the inner saboteur, whatever metaphor you want to use here. So any uncomfortable emotion can reinforce that for us. And the other thing people are unclear about is you're in denial or you're not. No, there's also levels or degrees of denial. It's not just about being on or off. So the first level of denial, and I run into this a lot with a lot of my chronic pain patients, lack of information or wrong information about the problem or how to get in the solution. For example, a lot of my pain patients who get in trouble with their pain meds, misuse, abuse, pseudo-addiction, or addiction, they often are total denial about it because I have the MRIs to prove I have a reason for this medication. It's being prescribed by a licensed physician. Who the hell are you to tell me that I have a problem with it? That's the first level. They do not need intense psychotherapy or a residential program. They need some accurate, objective, knowledge-based information. Now, for me, if I move down to the next level of denial, conscious defensiveness, deep inside, I know something's wrong with this picture, but I won't admit it to you. No way, no how. I'll defend it to the very end. And if you finally challenge and call me on it, hook me up to a polygraph, and there's 2 scales, right? They'll say, Steve, do you think you have a problem? Absolutely not. The truth scale does not come up. It's the liar scale that gets flared up. Now, what happens, I don't know about anybody else, but has there ever been a time when you ever told lies so often you started believing them? That leads to the 3rd level, that automatic and unconscious level, where we're protecting ourselves against this painful reality and this helpless, hopeless feeling that we have. If I'm at this point, there's all kinds of objective evidence that I have a serious problem. This time, if you hook me up to a polygraph and say, Steve, do you think this is a problem? I'll say, absolutely not. And it'll show the truth scale, but it's the truth as I perceive it, not the truth. And the problem with staying at this level long enough is some people actually get to the 4th and most difficult level is the delusional level, where we develop deeply entrenched mistaken beliefs that we hold on to in spite of all evidence to the contrary. So those are the levels of denial. And the good news is people can overcome any of these levels. So on this one, I want to talk about the anatomy of denial to kind of sum up this section a little bit. And remember, denial is triggered when we have to think about or talk about our painful reality. Now, here's where we want some audience participation. There's an image on the right side of your screen. There's no wrong answers here. So what do people think about when you look at that image that's on the right side of your screen? What do you see? Let's see if anybody responds, Kelly.
Okay.
It's your turn. Is there anybody out there?
I'm asking them to write, what do you see?
What do you see? What do you see? What do you see? Because there's no wrong answers here. Different people see different things.
Someone wrote they saw a stop sign.
A stop sign, yeah.
I'm going to say I see a window.
A window.
Someone wrote they see order and
order.
Someone else said they see focus.
Focus.
Another person said they see a stop sign.
Yep.
Oh, someone said they see an onion with many layers.
Onion. Unpeeling the onion. You know, I had one person that says, well, Steve, when I look at that, I see a toilet seat. I says, too much information. Then when I was doing a big conference in Missouri, and one good old boy got up and he says, that's me looking down the barrel of a gun.
Wow.
So the old
someone
Kentucky bowlers.
Someone else said they see a lens, like a camera lens.
A lens, a camera lens, yes.
Many stop signs.
Okay, so when I first developed this, I says, okay, what does it remind me of? Well, I have a big escape mechanism I use called sci-fi fantasy. And my favorite one is Star Trek.
Yes.
So the Starship Enterprise. So for any Trekkies or Trekkers out there, when the Enterprise gets shot at, how does it protect itself? Let's see if people can type in the answer to that trivia question. How does the Enterprise protect itself from enemy fire?
People are still writing in their responses to the object.
Okay, that's fine.
I will say, if I could respond, I believe it goes into hyperspeed, right? It goes.
No, how does it defend itself? If it can't escape, how does it need to help itself? How does it help itself?
Oh, focus field.
It's being shot at. How does it protect itself to go? A force field, right?
A force field.
Shields.
Yes, force field.
A force field. Force field. So shields up. Force field, shields up, right? Well, guess what? We as human beings have shields too, or force fields too. And it's comprised of 12 pieces, and there's an outer ring and an inner ring. The outer ring has the pattern of comparing. I compare myself as better than or less than other people. That's a protective mechanism. There's also the one about manipulating. I want somebody else to come in and fix my problem for me so I don't have to work so hard, or maybe it's because I don't think I can do it myself. Then there's the recovery by fear, or for many of us with chronic pain, it's that fear of change. And for other people, it's compliance. And there's two faces to this one. It's pretending to go along to get people off my back, or it's pretending to go along so people will like me, people pleasing or malicious compliance. Then there's I'm cured. I get to a point where my symptoms are leveled out and everything's cool. I don't have to keep going doing the same things I've been doing. I don't have to go to physical therapy, hydrotherapy. I don't have to go see the therapist, all that stuff. Everything's fine. And then there's the hopeless one. This one has two faces also. One is pretending to be hopeless using a little manipulation. And the other one is where I'm in that chronic pain trance where I am hopeless, helpless, and see no way out. And then the seventh part of this shield is I have the right to be the way I am. I have the right to do it my way. It's my way or the highway. And those reinforce our primary defense mechanisms. There's 5, which are called avoidance, denial, minimizing, rationalizing, and blaming. These are our shields. These are our force fields that protects us against that painful reality. Now we're going to back and do another trivia question. The trivia question is on the Starship Enterprise. What is the fuel for the shields on the Starship Enterprise? What is the fuel source? Let's hear some answers. How are they fueled? And I'm going to wait till I get some answers.
Let's see if we have some true fans here.
Come on, guys, you got to be active participants here. It's not just about me.
They're thinking.
They're thinking. And you don't worry about having to spell it right.
Joanne says solar power.
Not solar. Although they do use a lot of solar power, but not the shields. They need something much stronger.
Someone says let's see, Chelsea says harmony, some type of energy.
Yeah, energy, yes, but what kind of energy? This is the trivia question. I guess I must be getting old. A lot of people, used to watch Star Trek all the time, but now when was the last movie out? A couple of years ago.
May says hydrogen.
No. Okay, ladies and gentlemen, the correct answer is dilithium crystals. The dilithium crystals is what fuels the warp drive and the shields on the Enterprise. So my next question is, what are our 4 primary dilithium crystals? I'll give you a hint. I've already told you the answer to this earlier. Now this one, I think everybody better be able to answer. What are our 4 dilithium crystals? The 4 primary dilithium crystals, energy for our shields. What fuels our denial?
Oh, everyone is now figuring out it was lithium.
Dilithium, yeah, dilithium. But what are our dilithium crystals? What are our 4 primary fuel sources for our denial shields? Short-term memory loss, because I gave it to you about 5 minutes ago.
Shame.
Yes.
Anger.
Yes.
Let's see, the other ones are starting to come in.
That's 2. Anger, shame, there's 2 more.
Fear.
Fear is 3.
Guilt.
Guilt. So anger, fear, guilt, and shame. But remember, any uncomfortable emotions can also fuel our shields. Now, this is my last Star Trek reference, I promise everybody. The Enterprise is cruising through space. Everybody on the crew thinks everything's cool, and all of a sudden the computer pops up the shields because it perceives danger. Our monkey minds do the same thing when it sees or perceives danger from painful reality. It shields up, and the energy is flowing because we have anger, fear, guilt, or shame, depression, loneliness, sadness, any kind of uncomfortable feeling is fueling our shields, and we want to protect ourselves against that painful reality. This is normal and natural for us as human beings. The only way to solve a problem, though, is to recognize we're having that problem. So before I was able to move beyond my chronic pain trance, I had to recognize I was in it and what was causing it. So that's why I'm breaking this down and helping people see all the different pieces that we need to look at. I go in more depth about this in my book, that Thank You Adversity for Yet Another Test. There's a whole big section on denial and denial management. And it shares how for the patients, I picked 4 composite patients that went through our program, a 6-week residential program, and what their levels of functioning were coming in versus going out, and what some of the action steps they needed to do. And in one section, I explained, I had each of the 4 share their primary denial patterns, 3 primary denial patterns, and how they were going to identify and manage them in the future. So that's what we need to do. We need to say, okay, which one of these patterns am I most vulnerable to, and how am I going to use my accountability partners to help me see it and overcome it, so I can cope with painful reality and move into positive acceptance and make better decisions by using pause, relax, reflect, decide, and do. Now it's your turn again. What's the most important thing you learned about the inner saboteur, about your inner saboteur in this section? And what are 1 or 2 things you can do differently to improve your levels of function or quality of life? What could get in your way? If you identify a problem, be thinking about what's the solution. And most importantly, who are 3 appropriate accountability partners you can ask to be part of your team? And then I would really invite people, if you have any comments or questions, anything left over from this section, now's your time. Go ahead and type them in.
May wrote, I've been working on taking off my thick cumulative armor.
Yes.
Anita said, I really liked we train people on how to treat us, that comment that you had made.
Yep.
It's difficult during this world that we live in of instant gratification to relax and reflect before executing.
Yep. I had one patient share with me, Steve, there's only one thing wrong with instant gratification. It's not fast enough. We always want more.
It was interesting how you said denial was not good or bad in itself, and someone said fear for me is really not good or bad in itself either.
Absolutely. That's why I don't label feelings as good or bad. They're comfortable or uncomfortable. They're not good or bad. We are built as human beings to have a biological, emotional response that turns into what we call feelings by going through our psychology. So it's a normal part of being human. And fear is one of the emotions that allowed us to be the dominant species on the planet.
One person said, you know, I'm really more of a Star Wars girl than a Star.
Yes! May the Force be with you. Use the Force then. Use the Force.
Yeah.
Step away from the dark side. That's the monkey mind.
Joanne says, letting others see my pain is the biggest problem.
Yes, it's hard to let other people see us vulnerable, whether it's emotion or physical pain. I agree. That is still a challenge for me. And even I hide that from my wife, who I've been married to for over 32 years. Sometimes I still want to hide that from her.
Mm-hmm.
Anybody else? Any questions, comments before I move into our next segment?
Maybe we should move on. Just
move forward. So this is the beliefs, perceptions, thoughts, feelings, urges, actions, and social reactions. So the premise here is beliefs and perceptions cause our thoughts, our thinking patterns. The thoughts lead to our emotional response. Thoughts and feelings lead to an urge or an impulse to do something. The urges plus decisions cause the action. That's why decision point management is so crucial. And for every action, there's a social reaction. The old, I'm not hurting anybody but myself is a lie. It's not only a lie, it's a damn lie, because we're hurting people close to us. And that's why we need to remember this, getting ourselves some breathing space and using that process of pause, relax. So it's really this simple. I'm not going to go any more deeper than this into this, but it's a problem solution process. When I work with somebody, imagine there's only one side of the screen, the negative self-defeating side. So I want to explore with people, what are some of your mistaken beliefs and screwed up perceptions that are causing you harm? What are your negative self-defeating thinking patterns? What is your monkey screaming in your head? What are the uncomfortable feelings you're experiencing? Your dilithium crystals. What are the uncomfortable emotions? What do you have an urge to do? And then what do you actually do? And how does that affect you and other people? What's the social reaction? So I'll go through and help people identify that, going with one specific incident where they had a painful reality. Let's go back and see how this happened. What must you have you believed in order to get yourself to do that behavior you did that caused this painful reality? What were you thinking? What were some of the uncomfortable feelings? Do you remember what else you had an urge to do besides what you actually did? And how did it impact you and other people? What was the harm? Now, then we move over to the solution. I says, and don't worry, because we're going to move into the solution. We need to learn to identify mistaken belief and skewed perceptions so we can say, that's not true for me anymore. I can let go of that old way of believing and perceiving myself, the world, and other people. I can change and challenge negative thinking by coming up with some positive strength-based thinking challenges. I can learn how to manage uncomfortable emotions with the help of people, other people, and my higher power. I can use the pause, relax, reflect, decide when I hit the urge and impulses, so I can, at the action step, the do it step, I can make healthier decisions and come up with healthier actions. And the last window is where I pull in my accountability partners. Who can I invite to be part of the solution rather than part of the problem? How can they support me and doing this work in the right-hand column, the solution column? I don't have to do it alone. I have to do it myself, but I should never try to do it alone. Doing it alone is like walking in a dangerous neighborhood all by yourself without backup. Don't want to do that. You deserve to get some help. And again, this process is really described step by step in my book if you want to learn more about it, and you'll get to see some of the examples of people that walk through this process. And the last part that I really want to get to is exploring our relationship with pain. And so there's a few parts to that: understanding pain and the pain system, the biopsychosocial spiritual components of pain, how pain affects the whole human being, the whole person, every part of me, and the connection between stress and pain. So one of the things we need to educate ourselves about is the difference between acute and chronic pain. There's a big difference. I just came off of a major acute pain flare-up where I injured myself last week, and I had to practice what I teach. But chronic pain is something you live with day in, day out for a long time. So and it leads to the brain, pain brain. The brain gets remodeled. Recurrent acute pain is also known as pain flare-ups. Any of you ever have any pain flare-ups? You know, and a lot of times people have a mistaken belief about that is, I'll just take extra dose of meds. And that's the worst thing you can do for a pain flare-up in many cases. Then there's the big one, and there's a whole article on my website that I would encourage you to look at, is anticipatory pain, the role of anticipatory pain in chronic pain. So that's a biggie. Neuropathic pain is how the central nervous system gets remodeled and the pain system is not working as designed. And the most important solution here, my belief is we need to learn to make peace with our pain. And making peace with pain means the first thing, this is one of the steps of getting myself out of that chronic pain trance, was calling a ceasefire and stop seeing it as the enemy and stop the unnecessary suffering. Pain is not an adversary, it's my ally. Today, when I have a pain flare-up, it's my barometer. It's telling me one or two things has happened. Number one, I've done something physically I shouldn't have done, or number two, I'm not dealing with something psychologically, emotionally. And I have, over the years, made my pain my best friend. Now, don't get me wrong, there's sometimes I want to slap my best friend upside of the head, but it's still my friend, and we make peace. And we can't always eliminate that physiological pain, but we can stop suffering with it. That is very, very doable. And it's vital to experiencing freedom from suffering. It's calling that ceasefire, making pain our ally, and making peace. We have to do that. And to do that, we need to understand that there's four core components of pain. There's the ascending signal that goes from the point of origin, like my lower back, up to my thalamus, that's telling me, uh-oh, something's wrong. Or I'm having some neck and shoulder pain right now, and it's going up there and saying, uh-oh, something's wrong. I didn't even recognize that until I started thinking about it right now. Now, then what happens is our brain interprets and assigns a meaning to that pain signal. And we can go from the spectrum of, ouch, this hurts, to, it's killing me. It's horrible. It's awful. It's terrible. And then there's the social piece that's part of the descending pain reaction. It's the role that we assign to ourselves or others assign to us as loser, sufferer. And there's also family and culture beliefs about pain that need to be explored. And then finally, it impacts our spiritual values, practices, and principles. So these four need to be identified and addressed in order to have freedom from suffering and good outcomes. And the spiritual is the glue that holds it all together. That's our unlimited potential right there. And many people I've worked with had very, very poor spiritual scores coming in. And one of the reasons for that is they confused spirituality with religion. And there's a big difference. And that's one of the articles on my website too. You know, when you look at my website on the articles page, down at the bottom, there's the article archive and the video blog archive. So I only put 3 or 4 or 5 articles or blogs up at a time, but there's the archive where I put a lot of other ones. So I would encourage you to scroll through that. These are free. And I put about the first third or half of the article. And if you want the whole thing, just email me and I'll send you the PDF of the whole article, because this is really some important stuff that we need to learn in managing our pain. And the big piece is learning the connection between stress and pain. As our stress goes up, our pain goes up. As our pain goes up, our stress goes up. And we need to learn how to make a personal stress thermometer. I'm giving you an example of one right here. How much time we have left, Kelly?
Well, we've gone over the hour, but just rocking and rolling. So
okay, so I'll cruise through this piece. So we have 4 stages. We have the relaxation stage is the first one. You know, when you first wake up, you're totally relaxed, nearly asleep. Then you start getting on board. You're on autopilot. You might be getting up, doing things. Then you're relaxed and start gaining some focus. I call this vacation mode. I'm focused, but my focus is on chilling out and relaxing. Now, I'm not going to get much done when I'm in this blue zone. So I need to be in the functional level, the positive level of stress. And at level 4, I come online. I get focused and active. At level 5, I'm on cruise control, flowing with no effort. Level 6 is the danger zone, especially for those of us living with chronic illness, chronic pain, chronic disability, because that's when it starts taking extra effort and we start depleting ourselves. But level 7 starts where biochemistry kicks in. It's no longer psychology, it's now biology. We hit the stress reaction where we start having an inability to focus. We get spacey. At level 8, I get irritated, agitated, driven, and defensive. At level 9, I call that my foot and mouth stage. I'm going to say or do something I'm going to regret, but I just can't stop it. And for those of us with severe, moderate to severe trauma histories, we have a real propensity, if we hit the right trigger, to go into a trauma reaction. We can have a loss of control. This is where people in recovery from a substance use disorder are high at risk of using or using self-defeating behaviors. If it goes up higher, we lose touch with time and place, called dissociation, or we totally collapse, have a psychosis. We're not here anymore. And a psychotic break is what they used to call it. So identifying the stress thermometer is the first part of stress management. So we need to understand it and learn how to label, why am I at a level 5? I'm at level 5 because everything's going so smooth, I'm not even having to push. Level 6 means I'm having one of those days where it's taking a lot more effort than usual. My goal is to keep it below 7, but remember, 6 is the last chance we have full access to our frontal lobes, because when we get into 7, the brain starts moving into the monkey mind, fight, flight, freeze, survival brain. So we're starting to lose some of our executive cognitive functionings when we hit 7. And we need to make sure that we let people around us know, when my stress goes up, I need to call a timeout. And if you see me stressed out, please remind me to take a timeout. And what do I do when I'm in that timeout? We talked about that's part of the decision making. Relax. That means we have to start breathing or doing some other relax tools. I'm going to challenge each of you. My call to action for everybody is to develop your own personalized stress thermometer. And I'll give you 2 examples. This is an example of what one person came up with, the Stressometer. And this was a military person I worked with. And you can kind of tell by the top part, Mayday, battle stations, nuclear, shields up, that kind of thing. But this is a personalized, so it personalized it with their own colors and everything. So this other person had just watched Armageddon, and so the meteor strike was a level 10. And started out with water world, calm and everything. And then we got into weather where I like heavy downpours and thunderstorms, but when it gets to monsoon, no, that's a little troubling. Tidal wave, tsunami, and earthquake. So it's personalizing your own stress thermometer. And then what do you do? Well, the combination of deep breathing and progressive muscle relaxation is one of the best tools for people living with chronic pain, because it releases the muscle tension that faulty bracing syndrome, many of us with chronic pain experience. Guided imagery, there's many of them out there. Eckhart Tolle has many of them. Deepak Chopra has many of them. So finding something that works for you. Making a gratitude list. It's impossible to stay in suffering and gratitude at the same time. So a lot of times when I'm working with someone, if I see them slipping into a chronic pain trance, we stop and we're not going any further till you write down 10 things. And keyword, write down, not just say, but write down 10 things you're grateful for. And it changes the whole attitude. It's impossible to stay in suffering and be grateful at the same time. Prayer and reflection, tap into that spiritual core. That's unlimited potential there. And self-hypnotic or subliminal recordings. One I use is Potentials Unlimited. So Google Potentials Unlimited. Stress and anxiety relief, relaxation, relief, stress and anxiety, pain relief. They have all kinds of different titles, but you have to use those once or twice a day for at least 30 days to really build it up and start reprogramming your brain. Then nature walks and hikes, prayer and meditation, aerobic exercise if possible. Mine, I need to do it in the water. I was so glad when the YMCA reopened again because I could not figure out how to swim on virtual. It just wasn't working. So yoga and Tai Chi, noticing where I'm holding the tension and then breathing into it and relaxing it, soothing music. But I got to remember what's soothing for me might not be so soothing for somebody else. And I want each of you to think for a minute, what are some ways you lower your stress? And please, everybody, write some of those down right now. What are some ways you lower your stress? I'm going to show you one of my favorite ones. And this is my dog, Becca. She's down on the floor right by me right now, actually, just in that position, taking a nap. She's 12 years old now, slowing down, but she's still my hero. And she helps keep me calm. So animal-assisted therapy is really awesome. She was one of the emotional support animals in our program, plus we did equine therapy. So animal-assisted therapy is really good for people with chronic pain. And again, it's your turn. What did you learn about identifying and managing stress in this section? What can you do different? What could get in your way? And who are people that can help you? So we're almost at the end here, so I'm just going to go ahead. Just make sure to at least list a couple of things you're going to do different for your stress. And this is the big part of the whole day, exploring pain versus suffering. So pain is that physiological sensation that tells us something wrong. Suffering is how we misinterpret it, and it becomes awful, terrible, or unbearable. And pain's inevitable, suffering's optional. That's a Zen saying that goes back thousands of years, and it's very true. My wife, when she co-authored the book, Freedom from Suffering, A Journey of Hope, and this was her tagline: freedom from suffering is your right, but it's also your responsibility. Nobody can give it to you. You've got to give it to yourself. And so when I talk about pain or suffering, we get to have to see about how much is physical and how much is psychological. So in the book, there's a whole instrument, and I've just picked the pieces of it. These are some of the symptoms that I call physiological pain symptoms. You can see aching, throbbing, splitting, piercing. The ones in yellow are neuropathic symptoms. So these are all physiological symptoms of pain. These are the ascending pain signal that goes up to the thalamus that the brain interprets. What happens on the other side is how the brain interprets it in many cases, with things like it's dreadful, it's severe, it's irritating, nagging, saddening, depressing, distressing, excruciating, grueling, punishing, upsetting, aggravating, terrifying, dreadful, fatiguing, debilitating. All these are part of a pain. We are not making these up. These are how our brain functions. And with prolonged exposure to pain signals, it becomes like an amplifier circuit. It boosts these dysfunctional, distorted signals, the pain brain. Neuroplasticity is the technical term. And I have a whole article about that too. And I like to go right brain. I gave one of my patients, when she first worked for me, bring in an artistic interpretation of your relationship with your pain right here, right now, when we first started working together. And this was her, my pain, the monster from within. This was the act. I took a picture of this. This is what she brought into me. So suffering might look like this for some of us. That's a pretty scary dragon, right? Now, making peace with pain, this is what happened when we were getting ready to terminate therapy and she finished with me. I says, I want you to bring in an artistic interpretation of your relationship with your pain today. And this is what she came up with: making peace with my pain. The pain is the dragon, and she's that little cartoon character. So big difference between the two, right? Between that one, the dragon, and this dragon. Big difference. Look at the dragon smiling and cuddling and everything. So making peace with our pain is very crucial, because if you focus on the hurt, you'll continue to suffer. If you focus on the lesson, you'll continue to grow. So move out of the problem into the solution, please. And you'll know you're being successful when you become knowledgeable, active participants and not passive recipients of your healing process. You are the captain of your treatment team, not the doctor, not the therapist, not anybody, but you. Healthcare professionals, our job is to be your coach and guides. And we need to be told that's our job. And we need to use a collaborative, strength-based, challenging approach. Our accountability partners have to have the ability to challenge us in a positive way. And we've given them permission to do that. We've taught them how to treat us. And we need to create a collaborative plan with interactive input from you as the captain of the team. You cannot expect somebody else to write your treatment plan for you. That doesn't work. And we need to have strategic recovery and relapse prevention plans for all four areas when we go downhill: biologically, psychologically, socially, or spiritually. We've got to have some interventions, how to get out of the problem, back into the solution. And by doing this, we become actively involved in understanding our pain and what is possible for treatment. We can let go of that magical thinking and the monkey mind. We can get into action, become self-motivated, and most importantly, we can develop positive family and social support. 3 accountability partners for a start. And this is my final call to action for people. And don't forget, create your own stress thermometer. And with that, I'm done.
Wow. Dr. Grinstead, thank you so much. The amount of information that you provided for us is incredible. Thank you so much for your time. I also want to remind everyone that there are many free resources on his website at drstevegrinstead.com. Be sure to check out the articles page and also the video blog page to hear a lot of the information he referenced during today's virtual symposium. Also, you'll have links to his books. These are my 2 that I have in my library that I use and keep as references. One is Freedom from Suffering, A Journey of Hope, and the other one is his newest book, which is Thank You Adversity for Yet Another Test. And these can be found, the links on his website, as well as on Amazon and Amazon Smiles. Thank you again for all of
one quick thing, Kelly, I also
Absolutely.
sent you a discount code. If you go to my Book Locker page, you can get a 20% discount. So if you include that link for people, I want to gift them with a 20% discount just for being here today.
Well, the gifts just keep giving. Thank you so much, Dr. G. This has been incredible.
All right.
Thank you. And thank you for everyone who hung with us, even though we went a little bit over. I don't think anyone is complaining about going over. The content was so wonderful.
All right. Well, thank you all so much again for allowing me to be here today.
Absolutely. We will have this available on YouTube as well. And after the session is closed, we will be able to, you can watch it from the beginning.
Bye, everybody.
Bye-bye. Now I just need to close out on Zoom, and we will be
Houston, we're still live.
I know. It takes a second to go back into Zoom because they kick you out. Now I just need to see if I'll let me do that. No. This happened last time too. There we go. There we go. Bye, everyone. Thank you so much for joining.